Pediatric Diseases lecture. Colic. Colic is from an unknown cause and is seen in newborns in an early infancy. Colic is when an infant between 2 weeks and 4 months of age who has crying episodes that occurs at least 3 times a week for longer than 3 hours a day and lasting 3 weeks. A child frequently outgrows the condition before the cause can be identified. However, healthcare professionals will oftentimes suggest that if an infant is on formula, to try and switch the formula, or if they are breastfed, to continue with breastfeeding. Diarrhea can be caused by many microorganisms like bacteria, viruses, and parasites. It can be caused by food allergies and certain medications such as antibiotics. It is diagnosed when the child has 2 or more watery or abnormal stools within a 24-hour period. Prolonged diarrhea can lead to dehydration and an electrolyte balance. It is suggested that a patient with diarrhea is given Pedialyte 2 tablespoons every 15 minutes. You are to try to continue food or breastfeeding if the child is being breastfed. Sports drinks, soft drinks, sweet teas are not recommended because they either do not contain electrolytes or they do not contain the correct amount of electrolytes that are safe for a child. An example of this would be Gatorade. What are some signs of dehydration? So lack of tears when crying, lack of urination are the most common. It is important to follow up with these children with diarrhea 24 hours after they are seen to make sure that the symptoms have resolved. Of note, in older children, if they do have the diarrhea, we do recommend the brat diet. The brat diet stands for bananas, rice, applesauce, and toast. We recommend that these foods are tried to alleviate the symptoms of diarrhea and to inhibit the electrolyte balance and dehydration that can occur. Failure to thrive is when an infant or a young child whose weight is consistently below the 3rd percentile on standardized growth charts and one who is 20% below ideal body weight for their length. Physical, mental, and social skills are also delayed in children with failure to thrive. They sometimes have failure to roll over, smile, coo, stand, or walk at age-appropriate developmental levels. It sometimes causes psychological factors or a problem with parent-child relationships. Also, some causes that can be for failure to thrive are patients that are diagnosed with cystic fibrosis or celiac disease. In order for a child to become not failure to thrive, they would need to consume 150% more of the calories needed to catch up on the growth chart. Obesity. Obesity is a child that is considered overweight if the BMI for the age is between the 85th and 94th percentile. Child is identified as obese if the BMI is at or greater than the 95th percentile. Reasons include family history, inactivity, high-calorie diets, stress, and rarely some metabolic or endocrine disorders. This typically has to do with hypothyroidism. Provide educational materials and encouragement for children and parents to refer to support programs. Children that struggle with being overweight or obesity have a risk of developing diabetes mellitus sleep apnea, and heart disease, among many other diseases associated with these. Common cold, also called rhinitis, has more than 100 causative pathogens and is highly contagious. Typically, these pathogens are viral, and we use palliative measures to help the pediatric patient get through the illness. Signs include nasal congestion, low-grade fever, and general malaise. Parents may need to be shown how to use a nasal bulb syringe to suction the nose of an infant. Secondary infections in the lower respiratory tract or in the middle ear can often occur. The common cold is typically spread by direct contact or respiratory droplet. Common secondary infections due to the common cold are strep throat, which causes a severe sore throat, fever, headache, and lymphadenopathy. If not treated with antibiotics, it can lead to scarlet or rheumatic fever. The cause of strep throat is typically caused by the bacteria Streptococcus. Scarlet fever causes a bright red, rough rash all over the child's body. Rheumatic fever is a serious disease that can damage heart valves if left untreated. Otitis Media. So, the tympanic membrane of a child's ear or an adult ear typically looks like has the color of a pearl gray. Some symptoms of otitis media in a child may be fever, irritable, and they may tug at their ear. A lot of times with otitis media, it is suggested that we wait 24 to 72 hours to see if the child's immune system will take care of the infection. There is greater incidence in children who encounter secondhand smoke, where they may have an increased instance of otitis media. Otitis media is often treated with amoxicillin or azithromycin. And if a child has recurrent otitis media over several months, a myringotomy, or also called tubes in the ear, may be done. These typically last 6 to 12 hours. The use of over-the-counter medications. Cough and cold products should not be given to children under the age of 2 years old. Complications include, but not limited to, death, convulsions, rapid heart rate, and diminished levels of consciousness. Giving a child more than one product that contains the same active ingredient can result in overdose. Croup is viral inflammation of the larynx and the trachea that causes edema and spasms of the vocal cord. Hoarseness and harshness or harsh barking cough and stridor during inhalation are very common. Infection occurs usually is self-limiting and the child typically recovers without treatment. The use of cool mist humidifiers or sitting in a steamy bathroom or to take the child into cool air may help the child. Children may need to be treated with corticosteroids to calm down the airways. Bronchiolitis is a viral infection of the small bronchi and bronchioles, usually affecting children younger than 3 years old. This varies in severity and is seen in children with a family history of asthma or exposed to cigarette smoke. Inflammation, edema, increased secretions, and bronchospasms in the respiratory pathway are common. Treatment includes acetaminophen and a bronchodilator inhaler and sometimes a nebulizer treatment. Asthma is the most common chronic health problem among children, triggered by many factors. Asthma results in two specific reactions, bronchospasms and inflammation. Asthma is typically marked by a non-productive cough, accompanied by an expiratory wheeze and shortness of breath. An attack can last minutes to days and may develop into a medical emergency. Asthma is typically treated with bronchodilators, anti-inflammatory inhalers, and sometimes medications that are preventative, such as Singular. Influenza or the flu is acute, highly contagious viral infection of the respiratory tract. It is transmitted by direct contact with moist secretions. High fevers and susceptibility of pulmonary complications like pneumonia are common due to the destruction of respiratory epithelium. Bed rest, increased fluids, and non-aspirin analgesics are recommended. The flu vaccines are available, but the flu shot cannot be given prior to 6 months of age. At 6 months of age, the child is given a half dose, and then 28 to 30 days later is given the other half dose to obtain full immunity. Flu vaccines are available, and the individual must be vaccinated before the onset of disease. There are certain drugs that do shorten the span of the flu virus. Those drugs are Relenza and Tamiflu. Relenza is not recommended for children under the age of 5, and Tamiflu is not recommended to children under the age of 1. Typically, these medications need to be given to the patient 24 to 48 hours of the first onset of the flu in order to shorten the time span of the illness. Conjunctivitis or Pinkeye is highly contagious and caused by a bacterial or viral infection. It is important to use good hand sanitization practices and hygiene. Do not share towels or anything that touches the face of the infected child. Disinfect any article that may be contaminated. If the child is treated with antibiotics, they must be treated for at least 24 hours prior to returning to school. One of the most common antibiotics that is prescribed is Neosporin drops. Tonsillitis is the most common caused by Streptococcus A. It causes intense pain within a short time, in addition to fever and general malaise. Bed rest and a liquid to soft diet and analgesic throat spray or oral antibiotics if causative organism is a bacterium are common treatments. Other diseases or problems that occur with strep infections, if not treated, are rheumatic fever and scarlet fever. When doing throat swabs to diagnose a child, it is easiest to have the child lie down and do the throat swab. Therefore, if they are sitting up, the child will sometimes escape when you are trying to swab the back of the throat. Fifth disease is also called erythema infectiosum, or parvovirus infection, or also called slap cheek disease. Symptoms begin with a mild fever and general malaise, leading to flushed cheeks and a rash. Children with sickle cell anemia and chronic anemias or impaired immune systems may become seriously ill and may need to be hospitalized. Infected pregnant women have an increased risk of miscarriage and possible severe anemia in the fetus. Hand, foot, and mouth disease is caused by the Coxsackie virus, which is ingested and transmitted by direct contact with the nose and throat drainage, saliva, or stool of an infected individual. Fever, sore throat, painful blisters on the tongue, mouth, palms, and soles, headache and anorexia, and also irritability can occur. Most common complications is dehydration because the child does not want to drink due to the sores on the tongue and the mouth. Rest, fluids, and acetaminophen or ibuprofen for fever or discomfort are the most common treatments for hand, foot, and mouth disease. It is important to note that children should not return to school or daycare until all the sores are no longer present. Varicella, or often called chickenpox, is caused by a member of the herpes virus group, transmitted by direct or indirect droplets from respiratory tract of an infected person. The incubation period is 14 to 21 days, and then a slight fever for up to 3 days prior to skin eruptions occur. Infection lasts approximately 2 weeks and usually leaves the child with lifetime immunity. Then the varicella or herpes virus migrates to the dermatome and hibernates, and may later on become active in life, which then causes shingles. Varicella virus vaccine is also called Varivax, is available, and typically we give this vaccination at 12 to 15 months and then a booster at 4 to 6 years old. Children with allergies to eggs should not receive this vaccination. Newborns and individuals with impaired immune system may get very ill and even die if they contract the varicella virus. Varicella can cause stillbirths and birth defects in pregnant women. Meningitis is the inflammation of membranes that covers the brain and the spinal cord and is caused by a bacterial, fungal, or viral infection. Bacterial meningitis, sometimes called spinal meningitis, and is one of the most common serious types and is oftentimes seen among college students. Sudden onset of fever, headache, back pain and stiffness, vomiting and irritability are common symptoms. It is treated with immediate hospitalization and IV antibiotic therapy. We now have the meningococcal vaccination, which is given to 11 to 12 years old, and then a booster is given at 16 years old to prevent this meningitis. Meningitis is caused by H. influenza serology type B, or Hib, and can be prevented with the Hib vaccine. Meningococcal vaccines are for older children. Hepatitis B can lead to a serious chronic infection of the liver and can be transmitted across the placenta during the birth process if the mother is infected. It can be transmitted sexually by blood transfusion or by direct contact of blood. Immunizations are typically given at birth while in the hospital at 1 to 2 months and then 6 to 18 months. Reye syndrome is of an unknown cause, but some have linked children taking aspirin for a viral illness that may be the cause. It is an acute and sometimes fatal illness that is characterized by fatty invasion of the inner organs, especially the liver, and swelling of the brain. Children of any age should not take aspirin. There are 5 stages to the Reye syndrome. And you can see the signs and symptoms of each of the 5 stages. Autism. The cause of this developmental disorder is unknown. Researchers believe that it is due to a combination of genetic errors and environmental factors, and perhaps a problem with the fetal brain development. Although many parents are concerned about the connection with the vaccines, typically the MMR vaccine, extensive studies have failed to show the link of the two. Impaired social interactions, and they do not respond by name, they avoid eye contact, and show limited interest in surroundings. Often have a very high pain tolerance, but are extremely sensitive to sensory stimulation. Treatment involves educational and behavioral interventions and sometimes medications to treat depression, anxiety, and obsessive compulsive disorders. Children are often screened using the MCHAT, as you see here. These screenings occur at well-child visits at 9 months, 18 months, 24 months to 30 months. Typically, we do these screenings if we have any suspicion that autism might be. Cystic fibrosis is an autosomal recessive genetic disorder that prevents normal movement of sodium chloride or salt into and out of the cell. Buildup of abnormally thick secretions in the lung and blockage of the pancreatic ducts cause malabsorption problems. Salty taste to the skin, steatorrhea, or a large, greasy, foul-smelling stool, abdominal distension, failure to thrive, chronic cough, and frequent respiratory infections are all common symptoms. Treatment of the disease is complicated and requires multi-specialty approach, but oftentimes these patients will have to undergo percussion therapy, which includes a vest that they have to wear that percussions the back and the chest to break loose the mucus that develops in the lungs. These patients are also given mucolytics such as Mucomyst and bronchodilators to prevent bronchoconstriction. Oftentimes, cystic fibrosis is tested at birth in all states and is confirmed by the sweat test, which measures the chlorine in the sweat. The sweat test works by administering pilocarpine and then electrically stimulating this area. After 5 minutes, the sweat is collected onto filter paper and it is sent to the lab to see how much chlorine is present. Duchenne's muscular dystrophy is an X-linked genetic disease passed from mothers to sons, causing progressive muscle degeneration. It develops before age 5 and is marked by muscular weakness, frequent falls, and waddling gait, possible swallowing problems, and difficulty climbing stairs. Respiratory insufficiencies and infections are common. This disease has no cure and no specific treatments except for supportive care. Typically, these patients only live to their middle teenage years.